complicated affair. We're working very closely with all levels of government to make sure we express our needs, and to date they've been very responsive.
Kevin Smith, good to speak with you. Thank you.
Always a pleasure, Matt.
Kevin Smith, President and CEO of the University Health Network in Toronto. Over the past couple of years, healthcare workers have gone from tired to exhausted to burnt out, and now they're staring down the barrel of what could be the worst wave of COVID-19 yet. On top of that, with every wave, medical procedures, as we've been hearing, have been cancelled to make time for staff to focus on the pandemic, and some provinces are still struggling to clear the backlog of people waiting for surgery. Rianne Booker is a nurse in oncology, the president of the Canadian Association of Nurses in Oncology. She's also been working in the intensive care unit during the pandemic. We've reached her in Calgary. Rianne Booker, good morning to you.
Good morning, Matt.
Thanks for joining us. How are you holding up in all this?
You know, I'm doing okay. I've had some good days. I've had some rough days. Definitely lots of ups and downs. And back in September and even early October, there were some really tough shifts for sure in the ICU. But I've got a great support system and some wonderful colleagues, and I think those things make all the difference for sure.
And yet, here it goes again. What are you most concerned about?
Well, there are a lot of things. So just as Dr. Smith was mentioning, I think one of the biggest worries that I have right now is just that the healthcare system is, facing another potential situation where it becomes overwhelmed very quickly. So we're seeing quite a bit of immune evasion with Omicron. So people with previous infection, even those who are double and even in some cases triple vaccinated, are still getting Omicron. So even though we're seeing, the early data from South Africa and the UK are showing that perhaps people are not getting as severely unwell, as Dr. Smith was mentioning, even a small percentage of a huge number has the potential to overwhelm our hospitals and ICUs. And what that means for our healthcare system, and of course, it's just not all about COVID, right? I worry that people who need care for other reasons, cancer, heart disease, mental health, all of this will once again get eclipsed by COVID.
What are you seeing with the cancer patients that you treat?
I've stepped away really from my role there. I've been focusing mostly in picking up shifts in the ICU and also helping with the vaccination program. I'm also a full-time PhD student.
You have a lot going on.
Yeah, it is. It's never a dull moment. But what I'm hearing from colleagues across the country is, and especially in Alberta, we know that more than 81,000 surgeries have been cancelled or postponed since the beginning of the pandemic. And across Canada, more than 560,000 surgeries have been postponed. And some of those are cancer surgeries. And we know that there's a direct association between delays in cancer surgeries and outcomes. So one example is a study that was published in the British Medical Journal in 2020, and it was pre-pandemic data. So it was data from January 2000 to April 2020. It showed that, for example, for every 1,000 women who have breast cancer, a 4-week delay in surgery is associated with 10 additional deaths. An 8-week delay in surgery is associated with 20 additional deaths. And a 3-month delay in surgery is associated with 31 additional deaths. So there's the delays in surgery, there's the delays in cancer treatment or alterations in cancer care delivery. Back in the fourth wave here in Alberta, Julie Rohr, a young mother from Calgary, she needed an urgent procedure to drain some fluid from her lungs, and she wasn't able to get into the ER because the ERs were full with people who needed care for COVID and other issues like that. So it's not just about COVID. This is impacting people with other conditions in huge ways as well.
And it's impacting your colleagues, nurses, who we've seen an exodus from the healthcare system because people are fried, people are exhausted, people feel as though what is going on, what they see is not being met by those in power in terms of enforcement, in terms of vaccine mandates, in terms of public health measures. How are your colleagues holding it?
Yeah, I think people are exhausted, as you mentioned, as Dr. Smith mentioned. I think there's a sense of despondency in some ways as well. and then a huge component of moral distress. And so there's a lot of cognitive dissonance in Alberta for sure, but I'm sure it's not dissimilar across the country. But where there is, a lot of a difference between what's happening in the hospitals and what's happening outside of the hospitals in terms of how people are considering how serious COVID is and those kinds of things. Nurses, we're a resilient, tough bunch, and people who've gone into nursing, I think they're drawn to the profession because of a desire to help others. And it's an immense privilege and honor to be there for someone during some of the most profound moments in their life. So it could be the birth of a child or the passing of a loved one and really everything in between. So I think nurses, I had tweeted this out the other day that I hear that a lot of people are done with COVID. Healthcare workers aren't done with COVID. We're going to be there for people. We're going to care for people no matter what. And really only SARS-CoV-2 can tell us when we're done with COVID. But to be fair, I think people are exhausted. And the critical care nurses that I work with, these are highly specialized expert nurses that have been on the front lines since the beginning of the pandemic. I'm in constant awe of them because I've only been doing this since early September. They've been doing this for 2 years now, and it is physically and emotionally exhausting.
What is the acronym that you come up with for people to create some guidance to stay safe? Everybody's trying to figure out what to do in this moment, and you have a little trick.
Yeah, so when it comes to COVID-19, I think there'll never be zero risk, but I think there are ways to be as safe as possible. So the acronym is I'm safer. And so I is getting immunized. So as much as people can get vaccinated, and if you're eligible for booster doses or third doses, please consider getting that as soon as possible. The M is use a good quality, well-fitted mask, and we're looking now that N95s or N99 masks should be used if possible. Ideally, these would be given out free by governments. In New York, they're giving these out with rapid antigen tests as well. They're giving N95s out because we know that COVID is airborne. S is limit the size of gatherings if you can. I know the Christmas season is here, and gatherings and connecting, it's really important for people's mental health and well-being, but trying to do that as safely as possible. That leads to the next one, rapid antigen testing. So that's the A, and I'm safer. And so getting rapid antigen tests if you can, and using them prior to events. And ideally, that would be within an hour of the event, not a couple days prior to the event, because you could become exposed after taking the test. And again, tests are not, those rapid antigen tests are not 100% guarantee, but they do add that extra little layer of protection as well. The F would be filtration, so consider getting a HEPA filter or improving ventilation. Not easy to do in winter in Canada. We were minus 25 here yesterday in Calgary, but if possible, opening some windows and getting ventilation flowing, getting the airflow moving. And then the R is remain at home if unwell.
I'm safer.
Yeah, I'm safer.
Thanks for what you're doing. Take care, and we hope that that guidance goes into the ears of those who need to hear it. Rianne, thanks so much.
Thanks so much. Take care.
Rianne Booker is a nurse in Calgary, president of the Canadian Association of Nurses in Oncology. If you're in healthcare, how are you doing as this new wave of COVID sweeps across the country? You can email us, thecurrent@cbc.ca. Your CBC News is next, and then...
It's not just that Leonard Cohen is studying the Hebrew Bible, he's studying Christianity, he's studying Christian folklore, he's studying Buddhism, he's studying Scientology. He says that there was never a religion that he didn't fall in love with.
You can hear that love of religion in every one of Leonard Cohen's songs. Coming up in 6 minutes, we'll dive into the lyrics, the poems, and the mystical inspiration behind one of Montreal's favorite sons. My name's Matt Galloway. You're listening to The Current on CBC Radio 1. Stay with us.
This is CBC Radio 1, 88.1 FM and 690 AM in Vancouver. Snap Judgment with Glenn Washington. We put our guards down. We pull our politics down. Someone says, hey, this is what happened to me. And it's one of those rare things where you really can see someone's heart change. The stories that really get people off their couch, get people to move, get people to change, get people to do something, are stories that also affect the heart. Snap Judgment with Glenn Washington. Sunday night at 10, 11 Atlantic, 11:30 in Newfoundland. And on the CBC Listen app.
The CBC News is next. Coming up in an hour, it's Q.
Alanis Obomsawin has been a filmmaker for more than 5 decades, telling groundbreaking and powerful stories. Stories that are often about Indigenous rights in Canada. You'll hear how Alanis looks back on her meaningful and revolutionary career in film.
This is CBC News from Vancouver. Good morning, I'm Robert Zimmerman. Dr. Bonnie Henry, Health Minister Adrian Dix, and Public Safety Minister Mike Farnworth will announce new restrictions to help slow the spread of COVID-19 and the Omicron variant. A news conference is scheduled for 1:30 this afternoon. We will have that live here on CBC Radio 1. BC is now recording 800 to 900 new infections per day. There are now more than 5,400 active cases in the province. Canada's Chief Public Health Officer is urging Canadians to avoid gathering in large numbers this holiday season. Dr. Teresa Tam says if people don't reduce their contacts over the coming weeks, hospitals will be overwhelmed.
Even if Omicron happens to be milder than the previous virus variants, because it's spreading so rapidly that even a small proportion of people ending up in the hospital is going to overwhelm our systems.
Canada reported more than 10,000 new COVID cases yesterday, with Quebec and Nova Scotia both setting record highs in the number of daily infections. In other news, a Montreal lawyer who made headlines opposing Quebec's religious symbol ban has been appointed to Quebec's Superior Court as a judge. The CBC's Nick Boisvert has more.
Justice Azimuth Hussein has a recent history of arguing against Bill 21 and doing so in a forceful and what turned out to be rather controversial way. During arguments last year on behalf of a group challenging the legislation at the Quebec Superior Court, Hussein referenced the Nuremberg laws introduced under Nazi Germany. Now, he didn't do that to directly compare Bill 21 to that historical injustice, but the fact that he referenced it at all ruffled a lot of feathers within certain parts of the Quebec media and, of course, with the Quebec provincial government. Hussein will now be sitting on the very bench, that court where he made those arguments. Now, this doesn't quite show anything about the government's immediate plans to potentially challenge or intervene on this bill. Prime Minister Trudeau has left that door open, but Hussein won't be sitting on a court that will hear arguments as this case moves throughout Quebec's judicial system. Nick Boisvert, CBC News, Chelsea, Quebec.
In international news, the number of those killed by Typhoon Rai in the Philippines is climbing. Officials say at least 375 people are dead, close to 60 others are missing. The powerful storm slammed into the Philippines on Thursday. Residents of the areas hardest hit are pleading for help.
I am calling the national government, the local government to please make all efforts faster as soon as possible. We are lacking out of foods, we lack water, and the gasoline prices getting high. Some of the markets are hoarding water.
Typhoon Rai is the strongest storm to hit south and central Philippines this year. Many roads and buildings are damaged and communication lines are still down. The Coast Guard is being deployed to help bring supplies to areas cut off by the storm. Severe flooding in Malaysia has killed at least 14 people. More than 50,000 others have been forced from their homes as the country sees some of its worst flooding in decades. 3 days of torrential rain over the weekend have devastated 8 states. Villages and towns are partially submerged by the floodwaters. And back here at home, travel restrictions have just been lifted on Highway 3 between Hope and Princeton, which means non-essential travel is now allowed. It's coming up to 9:04 and time to check all the traffic with Steve Chong.
Rob, in Vancouver, we have a crash blocking eastbound traffic on Southeast Marine Drive at Ontario Street. Emergency crews are on scene and traffic is being detoured. In Vancouver, there was a stalled car westbound on Highway 1 just before the Cassiard Tunnel. Also in Vancouver, a crash eastbound on 1st Avenue before Highway 1 that's now been cleared. In the forecast, snow mixed with rain is starting in the afternoon with a risk of freezing rain. Just 2 centimeters of snow expected. We're looking at a high of 1, but with the wind chill, it'll be -9. Snowfall warnings and watches all around BC this morning and for the week. Environment Canada says hazardous conditions are expected on the sea to sky starting this afternoon. 20 to 35 centimeters of snow expected by tomorrow.
And that's the CBC News. And Environment Canada is warning that the south coast and sections of Vancouver Island could see some snow and freezing rain today. Snow mixed with rain in Metro Vancouver and the Fraser Valley this afternoon with highs around +1. The snow should change to rain tonight with more rain tomorrow and warming up with a high of 7 degrees. Looking further ahead, a chance of showers Thursday, snow or rain Friday, and snow on Christmas Day.
Good morning, I'm Matt Galloway, and you're listening to The Current.